It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Hi, everybody. Welcome to Health Check. I'm Heidi Godman. Hope you're doing well on this glorious summer day. It is the first day of summer, so happy summer to you. But it's actually summer here, I think it's been summer here for weeks and weeks. I walked in and I was talking to the guys, Luke, my producer, who's our programming director, and also Liam, who's our intern this summer, a college guy, and then we're all talking about how hot it is outside. And you might be avoiding going outside, or maybe you're one of those folks who just loves going out in the sun, and it's so gorgeous. You know, the sky is so very blue, but the sun is so hot. So what do you do to protect yourself during the summer months? What do you do to protect your skin from the hot sun, which can do so much damage? And would you know how to spot something if there is something on your skin? We're going to be talking about that today. We're also going to be talking about some other things today that you might really want to think about if you're putting on a bathing suit, such as how do you bounce back to get a beach body, or just a figure that you feel good about after you have a baby. You know, you can have sagging everything after childbirth, and what do you do to fix that? Lots of things you can do. And have you ever noticed the Hollywood stars really bounce back quickly after they have a baby? Oh, how can you do that? There is a way that you can do that. Also, this is something that affects so many people, not the kind of fun thing to talk about, but it's nail fungus. It's very difficult to treat. A lot of older adults have to struggle with this, but there are a lot of really great, effective new ways to treat old nail fungus, so we're going to be finding out about that too. So the person who is going to give us all of the great advice about this is my friend Dr. Manjula Jegasothy. She is a skin expert. She is an aesthetic dermatologist, Harvard and Yale trained, and she's the founder of Miami Skin Institute in gorgeous Miami. And Manjula, I bet you know something about hot weather.
I sure do. One thing I'll say is lately it's been kind of windy, so we've actually had a little break from the heat. It's been fairly nice for June here, don't you think?
Well, at times I'm sputtering because I'm trying to think of when is it nice. In the evening, I think it's been a little windier. Yeah, that's been good. But right now it's gorgeous out here, and so folks I know are flocking to the beaches, and of course we have tourists all year round. Summer is a thriving tourist time, and everybody's out from school, and everybody goes to the beach. But this is the time when we really need to protect our skin.
Correct. Obviously, everybody's heard the things you need to do to protect your skin. Number one is, try to limit your direct sunlight hours to early morning or, twilight. Try to limit the time you're outside in the middle of the day. Those are the most important. And if possible, when you're doing your outdoor activities, to be under an umbrella as much as possible. I tell the crowd who is very interested in sun protection that no topical sunscreen is perfect. So, other than the times they're in the water, they should be under the umbrella. And if they are in the water, they do make those little plastic umbrellas that strap to your bathing suit strap now, where you have a tiny little shade right over you even while you're in the water.
Yeah, I need the kind that they can have just, that hovers over you all the time, wherever you go, sort of like a cartoon character. That would be good for all of us because the sun is so damaging. Tell us what it does aesthetically, but tell us also what it can do physically, the harm it can cause.
Absolutely. So essentially, the rays of the sun are UV radiation. So they're radiation in the visible spectrum of light. But we also know that there's rays that we can't see that physically damage the DNA of our cells, which is what then causes skin cancer. So essentially, why I wanted to do this segment is because, May was Melanoma Awareness Month, and that's for a reason. It's because we are all exposing a lot more skin than we, even in Florida, than we perhaps were in January, February. So, not only do we need to protect it, but we need to look at our skin when it's, at this time of the year when we are bearing it more and looking to see if there are any new spots and I want to teach everyone what to look for in new spots so that you can go to the dermatologist as soon as possible.
Okay, so what is it that we should be on the lookout for? Because I think everyone assumes like, oh, any kind of a mole or any kind of a spot could be dangerous. And that's not true, but it can be sort of confusing if you're not trained.
Correct. And so we have this common acronym of ABCDs of moles, which I think that as dermatologists we think is useful, but I think that patients don't really find it that useful. So I'm going to go over it, but I'm just, I think that just if they can remember ABCD, that would be great, but I think it's more important to remember it sort of on a more global perspective, and that is that anything that is brand new or anything that is changing significantly and quickly needs a visit within a week to 2 weeks to the dermatologist.
Okay, so brand new or changing quickly needs an immediate visit.
I mean within a week or so, within a week, 2 weeks.
Now, why is that?
Because that's how skin cancers grow. They grow very fast. And that's why melanoma is such a bad cancer to have, and why it's so aggressive is because it grows very quickly. So if you delay treatment for even 2 to 3 to 4 months, it can greatly impair your prognosis down the road.
Okay, so absolutely you want to be on the lookout for something that suddenly appears and get to your doctor as soon as you can. But go ahead and tell us those ABCDs, because I think that also can help people.
Okay, so these are the things when you do go to the dermatologist, this is what we look for. So the A is for asymmetry. So a mole that is asymmetric is much more likely to be bad than a mole that is completely symmetric in its shape. So if you have an oval-shaped mole but it's symmetric in both of its halves, that's good. If you have an oval-shaped mole that has a little finger projection to the appearance of it, or it has a little spike, or it has a little globule coming from it, something like that, that's bad.
Okay.
So that's A. So B is border. If you can trace your fingernail around the border of the mole, it's better than if you can't. So the border needs to be distinct.
Okay.
Okay.
So you want that. You want it to be symmetrical.
Yes, you want it to be not only you want it to be symmetric, you also want the border to be distinct from the skin around it. Meaning, like I said, you can either take a pinpoint or a pen or even your fingernail, and you're able to trace that border with confidence of that mole. If you find that you're going kind of all over the place with the pen or the fingernail, and you find that you really can't find where does the mole end and my skin begin, is that border distinct? Then you need to go to the dermatologist for that as soon as possible also.
Okay, so how about C?
So C is color. So anything that is an abnormal color for you. So if you and I are have different skin colors. I'm darker skinned, and so my moles will be, on the whole, darker than yours. So you kind of know, having lived with yourself your whole life, what kind of color moles you have. So if you see something that's suddenly changing color, and it's not a normal color for you, or something that appears that's not a normal color for you. So let's say your moles tend to be a medium brown. Mine tend to be a dark brown. If you suddenly see if I see something that's light brown, or I see something that's red or blue or white or any of those colors, I need to see the dermatologist. For you, if your moles are a medium brown and you suddenly see something that's a much lighter brown or a much darker brown, in most Caucasian people, that's what it is that it's a much darker brown, then that's bad too.
Okay, so you want to make sure that the color is something that you're familiar with, and if it looks different, then talk to your doctor about it. What about the D?
Okay, so the D is diameter. And this one is interesting because this one probably has the best data behind it, and it's the most useful. So if the diameter of your mole is larger than the eraser on a pencil, which is about 5 millimeters, then that's also something to be concerned for.
Okay.
Larger moles tend to be worse.
Okay. So you've got A, which is the asymmetry you want to be aware of. B is the border. C is the color. And D is the diameter. And some people even say there's an E. What's the E?
So the E is a medical term called eschar. which is really just an ulceration, or sort of almost, if it looks like the mole has some kind of a cut or scrape in it, even if you did it, if you accidentally cut it or caught it on something or on your clothing or something like that, and it doesn't heal, that is also a bad thing. So that must be seen by the doctor as well. And when I say it doesn't heal, I mean within the course of, a week or so.
Okay, but don't try and diagnose this at home. I mean, I think it's very good that we all know the guidelines of what doctors will be looking for, and it's good to keep track of things and note if they start to change. But wouldn't you say, Manjula, it's a good idea just to get to your doctor if you have any doubts or questions?
Absolutely. That's why we give you the guidelines, because then you know what to have doubts about.
Okay. I think that's very wise. Yeah. So how can we protect our skin? We can, as you mentioned, we can stay under shade. We can wear different sun clothing and wear a sunscreen. But what kind of sunscreen should we, and sunblock, right? We don't say sunblock anymore. It's sunscreen, because we can only screen the rays. We can't officially block them.
Yes, the FDA went through a whole rigmarole this year earlier about labeling sunscreen, because they consider none of it sunblock now, as do I. None of it really blocks the sun. It screens it out, meaning it filters out UV radiation in the A spectrum, B spectrum, and C spectrum, and that's a wide spectrum sunscreen. And the best ingredients that do that are zinc and titanium. It's the old-fashioned zinc that people used to put on their nose in the 1950s and go outside. That is still the best agent for sunscreen.
Okay. And what about an SPF? Should you be looking at that?
Yes. So we recommend at all times, the American Dermatology Association recommends at all times that you have an SPF of 30 or greater whenever you are outside, and that you reapply that every hour. A lot of people don't know what SPF stands for. It's Sun Protection Factor. And what that is essentially the amount of time that you can remain in the sun without getting a sunburn compared to without that sunscreen.
So it's a time element.
It's a time element, and that's what people don't realize. So they think if I put on an SPF of 100 in the morning, I can be out all day. And that's simply not true. Let's say it takes 10 minutes of bright, direct sunlight in South Florida or in Sarasota for you to get a mild pinkness to your skin, let's say, a mild reaction of whatever, the mildest kind of sunburn. So if you put on an SPF of 30, that increases that time by 30 times. So if it normally takes 10 minutes to achieve that pinkness, it will now take you 300 minutes to achieve it. That would be great, and technically then you could wear your sunscreen all day, but the problem is that you sweat it off when you're outside, and it washes off, even though now they're not allowed to say that they're waterproof or water resistant, because none of them truly are.
Mm-hmm. Yeah, so you've got to keep reapplying, you've got to be careful about it, and you absolutely want to use a broad spectrum sunblock or sunscreen, which is screening out the UVA and UVB rays, and try to use the best kind that you can. But the most important thing is just keep reapplying.
And really look for the ingredients, either titanium or zinc. There are other chemical blocks which some people like because they're a little bit less. They have less of a fragrance, and they're maybe a little bit more cosmetically silky. But honestly, they don't give you as good a block as plain old zinc and titanium. And there are good formulations of those now that actually Neutrogena makes them, Olay makes them, that you can get anywhere that have those ingredients. Look for those ingredients, and you'll be much safer.
Let me ask you one more question before we go to break, too. Do you need a stronger sunscreen on your face as opposed to other parts of your body, or the other way around?
People are more careful with their face, and they want to get more sun on their body, but that's bad. I know. I think people should protect all of it the same with an SPF of 30, reapplied every hour.
Okay. All right. We are going to continue speaking with Dr. Manjula Jegasothy, and in the meantime, you can check her out at Miami Skin Institute. And what is the web address? MiamiSkinInstitute.com, and visit me and Heidi's radio show at my podcast channel, MiamiSkinInstitute.podomatic.com. Terrific. All right, we are going to take a quick break. When we come back, more with Dr. Manjula Jegasothy. This is Health Check with Heidi Godman on WSRQ. Please stay with us. Welcome back to Health Check. I'm Heidi Godman. If you're just joining us, my guest today is Dr. Manjula Jegasothy. She's an aesthetic dermatologist, and we are talking to her about all kinds of things that you want to think about during the summer. So in our last segment, we were talking about protecting your skin. Now we want to talk about protecting your toes, because a lot of folks are wearing sandals and flip-flops, and that puts you at risk for getting nail fungus. And if you have it and you're wearing sandals and flip-flops, it's not going to help you get rid of it, and it doesn't look so great. And Manjula, what is nail fungus?
Sure. It's interesting. The data now is that something like 90% of Americans in their lifetime will have some sort of nail fungus, whether it's on the fingers or the toes.
90%. That's
90%.
That's disappointing. Okay.
Yes, and so it's much more prevalent than it ever was. And it used to be, like you said, that, you're in wet socks. It was commonly, we saw it in the military, things like that. But now the risk factors have changed quite a bit. And the number one cause is manicures and pedicures.
Really?
Yes, because the place where you need to go needs to not sterilize their instruments with that blue solution that you used to see. It was like barbicide, that kind of thing, like they used to use in the barber shops and the haircut salons. The places should actually autoclave their instruments, which is a steam sort of sterilization technique for metal objects, and that's the only way. Or if you bring your own instruments to the salon for you to get a completely clean result.
That is very interesting. I'd never heard that before. So you don't want a place that uses the blue stuff to sterilize their equipment. You want something that's going to steam clean them in an autoclave, you called it?
Correct, in an autoclave. And you're not going to necessarily, it's hard to be like, I want to go see your autoclave, when you're in the place. And it is possible even that they send the instruments out on a daily or weekly basis to an outside company that autoclaves them for them. But the way you will know is that you make sure that when they sit down with you to do your nail work, they open the instruments from a sterilized, sealed package that has a white paper on the back and a blue plastic on the top.
Okay. How do you find a place like that? Would you just call them up and ask?
Yes, you can. It's perfectly acceptable to call and ask if they autoclave their nail instruments. If the girl doesn't know, you can ask for the manager. Incidentally, all of the new sort of full-service chain salons, like Venetian Nail Spa, one of them to name a few, they all autoclave their instruments now routinely. So If you go to a corporate nail place nowadays, they autoclave their instruments.
Okay, good to know. And tell us what kinds of treatments are working now for nail fungus, because it used to be very difficult to get rid of, as I understand.
Well, one more risk factor I wanted to say, which is the second biggest risk factor, and is probably even more common in a state like Florida, is trauma, chronic trauma to the nails, such as which is seen in running or intense physical activity where your nail bumps against the shoe. Even if your shoe is the right size and there's no issue with it, you still create microscopic trauma with the nail whenever you are physically active. And that's probably the most common cause of nail fungus in men.
Okay. All right. Very good to know. So we have 3 minutes to break. So what can you tell us about treatment?
Okay, 2 new treatments. One is a topical treatment that requires a prescription called Jublia, Jublia, Jublia. Jublia. It's been the most effective topical treatment there is, and it's effective if you have mild nail fungus, and you can get the prescription with any physician, even your primary physician. And the second thing is if you have severe nail fungus, now there is a carbon dioxide laser that many podiatrists do that can completely cure your nail. And these are cases that had no treatment or cure before.
All right. Now, wait, where do you go to get that? To a podiatrist? Podiatrist.
Mm-hmm.
Okay.
Very few dermatologists have it. But if you Google carbon dioxide laser cure for nail fungus, you can find the doctors in your area who are doing it. It's a cosmetic procedure that's not covered by insurance, but it's well worth it.
So either a prescription drug, prescription medication, or the laser.
The prescription medication for mild, for moderate to severe, as you know, you would have had it for years, then the laser.
And does it recur if you have this prescription medication or you get a treatment with the laser? Are you at risk for getting it again?
If you have the laser treatment, if you had moderate to severe nail fungus, it took you 5 to 10 to 15 years to get it to that point without treatment. So technically, if you're still having trauma to your nails or you're still going to a non-clean manicurist, then yes, you could develop it again over the course of 5 to 10 to 15 years, but that's probably not the case. You're probably going to be more careful with the manicurist in the future, and maybe you would do other activities that would be less traumatic to the nails. If you have mild, you can definitely treat it with Jublia applied every other day for a period of about 4 to 6 months. And if you may want to do it after that, maybe once or twice a month to prevent recurrence.
Okay, well, very, very good advice. And if we want more advice on this, I'm guessing that we can find out from our podiatrists. But if you want more advice about anything that has to do with your skin and staying as good looking as you can and having young, healthy skin, then you can check out more about this on Manjula Jegasothy's website, miamiskininstitute.com. And we are going to continue speaking with her. So please stick around, Manjula. Everybody listening, we are going to speak in our next segment all about how you can bounce back to a great bod after you have a baby. How can you keep your skin looking great? Manjula is going to tell us all about it. This is Health Check with Heidi Godman on WSRQ. We'll be right back after this. Welcome back to Health Check. I'm Heidi Godman. Luke playing all my favorite music today. Thank you so much, Luke. We are talking today all about how to stay looking great, how to keep your skin looking healthy, how to keep your toes free of toenail fungus. And now we want to talk about bouncing back after baby. This is a very hot topic right now. And if you keep track of Hollywood types, you might know that John Legend's wife, Chrissy Teigen, a model, recently published a photo of herself just weeks after giving birth. She posted this photo and she looked amazing. She was in a crop top. She looked fabulous. And maybe you've heard other women who've just given birth wondering, oh my gosh, how did she do this? Well, you don't have to live in Hollywood to find out. My guest today is going to let us in on the big secrets. Dr. Manjula Jegasothy is a Harvard and Yale trained dermatologist. And Manjula, I bet you heard from your patients after Chrissy Teigen posted this photo. They must have been astounded.
Definitely. I mean, it's so interesting because I hear from my patients about this all the time. Probably as adult women, this is one of the sort of most precarious times in our life in terms of our overall cosmetic outcomes and how we're going to look afterwards. I think a lot of women go through a lot of changes while they're pregnant, and then afterwards are left, with a lot of changes in the body and a heavier frame. And if you feel like it's an overwhelming mountain that you have to climb, 50 to 70 pounds or more, and then all the changes associated with that, it seems like it's really not worth doing. And I'm sort of here to tell you that Hollywood does it with help, and so can you.
And so can you. Fantastic, because there are so many changes that can happen to the skin during pregnancy. Let's talk about some of those.
Okay, so the first thing is that there are lots of different rashes that occur during pregnancy and pigmentation issues that occur during pregnancy that can then persist into the breastfeeding phase and afterward if they're not properly cared for, while they're active. So there's a bunch of rashes in pregnancy which need to be seen by your OBGYN and treated immediately, which most of the OBGYNs are good at and can do. The dermatologists tend not to treat patients during pregnancy because, first of all, the OBs are expert in these rashes as well, and also they're just much more knowledgeable about what's safe to use when you're actually pregnant in terms of topical creams and cortisone creams and such like that.
All right, so you might get a rash.
Yes, and you might get a rash, but it's worth it to treat it because it could pigment and then make your stomach or your whatever area it is dark permanently, and then that would be something that would be much harder to recover from.
And what about stretch marks, too?
Right. So the second sort of, those are hormonal. And then the second thing that's hormonal that a lot of women complain about that then persists throughout life is a condition called melasma. It used to be called the mask of pregnancy, and it's not so much anymore because so many women are on birth control pills prior to pregnancy that it occurs often earlier in life. And so that condition is called melasma, and it's characterized by a brown stain on your face. It's much more common in ethnic skin types, in Latinas and Asian people than in Caucasian people. But if you don't treat it early, it can persist and become something you have to wear makeup for the rest of your life.
Mm-hmm. And some conditions that occur in pregnancy are just temporary. The linea nigra, that you have this little white line going up your belly that you don't know about. And I've had 3 children, everybody, so, I've seen this a couple of times.
Right.
It gets dark, and that really can be surprising.
So I tell my patients if they're done breastfeeding, so you can't do anything for any of these pigmentation issues other than light fruit acid skin peels, which I think are a good idea. If you know this runs in your family and you're starting to see it, even if you are actually pregnant or if you actually are breastfeeding, you can get these fruit-based acid peels, which are very safe to do, even while you're carrying baby. And that can, reduce the problem so that it doesn't become chronic afterwards. So I guess that's my message, that there are things we can do even during pregnancy and during breastfeeding to treat so that these things don't persist with you until your kid goes to college.
Yeah, yeah, absolutely. That would be very good. And you don't have to worry about the linea nigra because it goes away, right?
Right. Well, so if your linea nigra actually persists after you're done breastfeeding, for about 2 months after you're done breastfeeding, you should get that taken care of as well, because then there's a good chance it may persist chronically as well.
All right. And how soon after you give birth do these skin conditions go away? And we won't talk about stretch marks yet. We'll get to that next. But as far as rashes and then pigmentation, how quickly do they disappear after you give birth?
And so I tell my patients, if you give birth and you're not breastfeeding, by the time your baby's 6 months old, these things should be gone. And if they're not, you need to seek help to get them gone so that they don't become chronic. If you do decide to breastfeed, then you're adding some time on to that, and that's okay. After you're done breastfeeding, you should wait 3 months or so. And if they're not gone after 3 months, then you need to also go to an aesthetic dermatologist treatment, because again, this can become chronic. These are all hormonal related, and breastfeeding prolongs the pregnancy hormone status a little bit, but not to the extent of pregnancy. So therefore, it should be washing out during the breastfeeding phase. But it's okay to have it there a little bit. But after that 3 months after breastfeeding stops, everything should be pretty much back to normal, and so you need to make sure that your skin is as well.
Okay, so we want to talk a little bit about stretch marks and loose belly skin, and also another big one is varicose veins and spider veins. But we are going to take a quick break, so everybody, please stick around. More with Dr. Manjula Jegasothy in just a minute. This is Health Check with Heidi Godman on WSRQ. We'll be right back. Aesthetic dermatologist and founder of the Miami Skin Institute. And we are talking today about how to bounce back after you have a baby. Have you ever seen those Hollywood types who just, weeks after delivering a baby, they look amazing. They're running around the beach in a bathing suit. Well, Dr. Jegasothy says there's a little more to it. It's not just natural. And in our last segment, we were talking about skin issues such as rashes and things like that. But we want to talk now about a few different things that really seem to hang on after a while. And one is stretch marks and loose belly skin. And another is spider veins and varicose veins on legs. And Manjula, this seems like something everybody has to go through when you have a baby. It doesn't seem like you can get through a pregnancy without it.
Sure. So we were talking first about the changes in the skin, which are hormonally caused, and not everybody gets those issues. But I guess the take-home message was if you get them treated as early as possible, and you can even do some light fruit acid peels and things even when you're pregnant so that they don't become chronic. Now, this group of problems is things like you said that happen to everyone, Heidi, and they're related to physically carrying another human being inside your body for 9 months. So the first is mechanical factors related on the skin and muscle related to stretching.
Okay, so what happens? Why do we get this stretching? I mean, obviously the uterus is growing and the baby's getting bigger, but the skin, why doesn't it just stretch right back down?
So what it is it actually, and this is in, some people are more genetically susceptible to it than others, but physically it breaks the collagen fibers in the dermis of the skin. And lots of people don't realize that that's what's actually happening in a stretch mark. It's actually broken collagen in the second layer of the skin. So just like that, the muscle fibers break, everything suffers little tiny, microscopic breaks on a daily basis as the baby grows, particularly in the third trimester.
Now, I had 3 different pregnancies, and I had each time these same stretch marks that would occur. They sort of look like little lightning bolts on the sides. And after I had the baby, then you really couldn't see them. So I guess I was very lucky that way. I mean, I think they are still there, but I really don't see them or notice them. But what can happen to other people?
Yeah, so your genetics dictate, Heidi, that basically your skin repaired those breaks. And that's why they became less visible. For other people, they may or may not. I always tell people, okay, so the first thing is, in terms of, obviously I don't treat the muscle and I treat the skin, but if you are in really good shape and your abdominal wall and your back is in really good shape before you become pregnant, which is one thing definitely the Hollywood types do, is they get in the best shape of their lives in the 3 to 6 month period before they plan to become pregnant. So that, then you have a much better capacity to actually repair these breaks once you deliver. So your body itself, the muscle tone, the back and the abdominals will bounce back much better, the better shape you're in beforehand.
Yeah, plus you're going to have a better pregnancy. It'll be a bit easier, especially when you need to get out of bed with a huge tummy on top of you. You have a lot more strength in your abdomen if you have already strong core muscles.
Yes, everybody advocates, natal yoga. Definitely doing yoga during pregnancy and after, because that's something you can do very safely that really, really strengthens the core muscles, which then are repairing themselves even while you're pregnant. As the breaking is occurring, it's repairing it at the same time. So that's the best. After that, the skin, in my opinion, I think keeping it as moisturized as possible is, the best thing you can do during pregnancy and while breastfeeding, because I think that kind of hydration will definitely help the collagen fibers to turn over and regenerate. And even if your genetics aren't as good as yours, Heidi, perhaps that it will make collagen grow. We think that hydrated skin definitely is more healthy and more active that way in terms of growing collagen. Another thing that I tell my patients who are extremely worried or have a bad family history is before you become pregnant, or when you're sure you're not, because it's not safe to use Retin-A during pregnancy or during breastfeeding, but it is okay in the months before to use a little Retin-A on your stomach, because that improves collagen growth. And we think that, we've done studies there, for years on what can prevent stretch marks topically, and it seems that Retin-A is the only thing that grows collagen sufficiently. So I advocate for people to do it beforehand and then after breastfeeding as well to help collagen growth. If you're hydrating during pregnancy and breastfeeding, it might be nice to use something like a topical vitamin C. We know that that's going to not harm the baby. Make sure your formulation doesn't have any retinol in it. So a plain vitamin C serum or cream or something to keep your skin hydrated, and then also to prevent stretch marks.
Well, I think I must have just lucked out, because it sounds like there are a lot of problems that can develop from stretch marks. And do they ever stay pigmented after you deliver?
Yes, they frequently do. I mean, I'm seeing most of my patients, most pregnant women, I think it's around 50 to 70%, do not have the skin they had before. Whether it's either stretch marks, but then often if they stay pink, that pinkness will go on its own in about a year, but it can definitely be improved by the V-beam laser, which is the same laser we use to treat spider veins on the face. And then also they can be smoothed out with the Fraxel laser. So my point is Hollywood doesn't have a year to wait, or 2 years to wait for their stomachs to look better. So what they do is immediately after breastfeeding, they go in for these 2 laser treatments. And typically, if you do 1 to 2 sessions spaced about 6 weeks apart, most people are fine and don't have their stretch marks at month 4 or so.
Okay, so that's a good insider tip. And then what about the loose belly skin that occurs after you deliver?
So I love this one. In the past, there was nothing people could do except for tummy tucks. Literally, in the last 3 years, radio frequency laser, which is literally a laser that operates on radio waves, so it's the same as us on the radio, it's very safe, can tighten that skin and does a very nice job. Each session tightens the skin about 30%, and almost all of Hollywood is doing this as well. So immediately, again, after they stop breastfeeding, they go in for radio frequency treatments on any loose skin that they see. And again, probably after 3 sessions spaced about 2 months apart, so you're looking at month 6 or so, your skin is as tight as before.
All right, very encouraging. So that's a fractionated laser, you're saying?
No, that's the radio frequency.
That's the radio frequency. The fractionated laser was for which one? That's for the
stretch marks.
Stretch marks.
Them.
Okay.
Mm-hmm.
All right.
The V-beam takes the color out of the stretch marks. The Fraxel smooths the stretch marks. And the radio frequency tightens the skin, not just on the belly, but on the buttocks, the thighs, anywhere.
Okay.
Arms.
Okay, that all sounds good to me. And my youngest is now 13. So, all right. So, but what about some people get spider veins or varicose veins that show up in the legs? Why does that occur during pregnancy?
Okay, so again, this is extremely genetically predisposed. So if your mom has bad leg veins or varicose veins, or your grandmother, then you need to be extra careful when you're pregnant. And the best thing you can do is to try and keep your legs elevated above the level of your heart as much as possible during your pregnancy, and especially during the 3rd trimester. So here we have a little bit of a conundrum. Do I do yoga? There's lots of yoga poses you can do where your legs are above the level of your heart. You don't have to be on all fours all the time. So that's what I recommend. And if you tell a yoga instructor who's good at treating or taking care of pregnant women, then they will, adjust your yoga schedule so that it would be core strengthening while also taking pressure off your legs.
Okay. Not a lot of downward dog.
Yes, no downward dog.
Not downward dog. Okay.
No downward.
But then what about, so afterward, if it turns out that you did develop a spider vein or a varicose vein, tell us about the differences in those, because one is very superficial and one is a little bit more serious.
Yes. So what it has to do with is, again, like I said, genetics. And some babies sit on your pelvic floor in different ways. Some babies, they turn and their head is down fairly early in the pregnancy. Some babies don't turn until the very end. We find that babies that tend to have their heads down tend to press more on the pelvic vasculature or the pelvic vein floor, and then that tends to put more pressure on the leg veins and tends to cause more leg veins overall. The difference between the 2 sets of veins, varicose veins are sort of medium deep leg veins that then pop out, and these are mostly caused either in older people or in cases of extreme trauma while pregnant. So that's why I don't recommend high-impact sports and things like that when you're pregnant, because you're going to be more likely to pop a vein that's medium deep. The superficial veins that sprout up are from the pressure of the baby on the pelvic floor in a normal person with normal activity, but a predisposition to having these veins. And that's because the valves in the deep veins of the legs genetically don't push the blood back as efficiently as they could in other people, as they do in other people.
All right. So what do we do about all of these?
So essentially, once you've got a leg vein, it's not going away. So, my thing is always prevent that. So do the best you can about keeping your legs elevated all throughout this time. And then after that, if you do get some, depending on how they look, nowadays the V-beam laser, again, has different settings than it used to. We have a much more wide range of options in terms of settings, which can actually treat those leg veins. for a period of 2 to 3 years at a time, which is as effective as the injections used to be. So a lot of dermatologists are favoring the laser over leg vein injections because the downtime is less. You only have maybe a week to 10 days of bruising versus 2 to 3 weeks of bruising with the old injections. And then also the effectiveness is the same or maybe even a little bit better.
And when you use the laser, what's happening inside in the vein?
What's happening is the laser targets the red pigmentation, the hemoglobin in the vein, and literally explodes the vein. Okay, you don't need that vein. It popped out, from your pregnancy because your leg veins couldn't push the blood back fast enough. So we literally explode the vein, and then your immune system comes in, a specific cell that's called a macrophage that comes and eats up all the debris from the vein. And so that's why it takes about 2 weeks or longer for the bruising to resolve. Probably 7 to 10 days with the laser. And then you still might have a little pinkness or mild indistinct border of the vein. That's while your immune system is kind of carrying it away.
All right. And then what about price ranges? What should we expect to pay for something like this? And I'm guessing that insurance doesn't pay.
No, this is not. This is considered cosmetic. Anywhere from $400 to $600 a treatment if they're mild. You may need only 1 to 2 sessions if you have them all over, and that's unlikely. Any one pregnancy is unlikely to get you, no veins to moderate to severe veins right away. What usually happens is that people, say, oh, I'm going to have another baby in another year or two, or, I'm going to wait. So they go through their several pregnancies and then get it treated, and then that's when you require more treatment.
All right. Well, Dr. Manjula Jegasothy, thank you so much for spending an hour with us and giving us your insider expertise. We really appreciate it. And if someone wants to find out more about you, I know you have a website and you have a lot of different ways that we can learn about what you do.
Yes, I would love for people to look at my Google Plus blog posts now. We've been doing a lot with that, and if you Google any topic that I've written on, it comes up immediately. And so if you have any questions, ask Google, and my answers will show.
Okay. All right. And we can also look at you at Miami Skin Institute.
Yes, .com, or at my other blog at Miami Skin Institute at WordPress. You can find me, Miami Skin Institute, on Facebook, Pinterest, and Twitter as well.
Wonderful. All right. Great as always to talk to you. Thank you so much, Manjula.
Thank you, Heidi. Thanks for having me back. We'll see you again next month.
Okay. Take care.
Thanks.
Happy summer. All right, that'll do it for us. I'm Heidi Godman. My producer is Luke Roseborough, and you've been listening to Health Check with Heidi Godman on WSRQ. Bye-bye.